Maryland Family Network recommends taking these extra precautions during the COVID-19 pandemic to keep children and staff safe and healthy. Before you open each day, ask yourself these questions. Have you put procedures into place that allows for curbside or doorside drop-off to limit the number of people coming into your facility? Have all surfaces been cleaned using approved antibacterial and antiviral products prior to the start of each day? Is there a plan to properly clean and disinfect equipment and materials between uses by individual children using EPA-approved products? Do you have enough cleaning products on hand to keep surfaces clean during the hours of care? Are there sufficient developmentally appropriate materials to keep children engaged for the full day? Have you made arrangements for enough meals and snacks for children, including proper storage of food, sanitary dispensing of food, and disposal of food waste? Are staff aware of the required cleaning procedures during this health emergency? Are staff aware of COVID-19 symptoms and how to identify children and adults who may exhibit those signs? Now that you're open for the care day, we have a few tips to help keep everyone healthy. Staff should thoroughly wash their hands and have had a temperature check before interacting with colleagues, parents, or children. Staff and parents must wear cloth face coverings during drop-off and pickup, and when parents are performing and staff are observing temperature checks. Also, parents and any other adults who enter the building must wear cloth face coverings. Staff should keep a 6-foot distance when communicating with parents and colleagues. Do a quick visual check to see that children appear well and have children immediately and thoroughly wash their hands. Have a routine in place for social distancing. Limit the mixing of children in groups. Allow for individual and small group activities with space between children and sufficient materials so that those materials are not fought over. Arrange furniture so that children are not sitting close together. Plan transitions so that children are not using the restroom at the same time, each taking a turn and allowing space between themselves and others. Make sure that all shared materials are cleaned between uses. Increase the use of cleaning and sanitizing products on cell phones, tablets, and computers. Staff should not share personal devices. Regularly disinfect high-touch hard surfaces such as door handles, light switches, faucets, toys, and games. All tables and other surfaces should be disinfected prior to and after food service, after activities, and hourly. Also, staff and children should not eat at the same time to allow staff to adequately clean hands and disinfect surfaces between meals and snacks. When there is food service, staff and children should wash hands before and after that food service, and surfaces should be cleaned before and after food service. It's the end of the day, but there's still a few things left to do. All children and staff should wash their hands before leaving for the day. A deep cleaning of the facility should be done at the end of each day. All surfaces that children come in contact with should be thoroughly cleaned, including furnishings, equipment, and materials touched by children. Conduct an inventory to be sure that there is sufficient cleaning supplies, food, equipment, and materials to keep children engaged for the following day. Thank you for taking the time to watch this presentation and for all you do for Maryland's little kids. We are all in this together. Take a moment to visit our partners' websites for more information and for more resources. This presentation is funded by the Maryland State Department of Education through Maryland Family Network as part of the Maryland Child Care Resource Network.